Hello, everybody. This is Terry with the Pre-Mom team, and we're here with Tina Hickman, Nurse Practitioner and Midwife, to talk about all things about midwives. Super excited. This is new territory for us. And remember, before I forget, that you can find Tina right in your app. If you go to more scheduled consultation, you can find her and have a consultation. Tina, can you tell us what midwives are, your background, all that good stuff?
Yeah, so I just like any other nurse, I started out in a 4-year nursing program, got my bachelor's in nursing. I quickly went on from there and got my master's and my nurse practitioner degree. I actually specialized in women's health as a nurse practitioner. So I worked with women for 5 to 6 years and then decided I wanted to go back and get my certificate master's degree in midwifery. So went back to school once again and became a midwife. And I've been a midwife for a couple of years now. So you don't have to go the nurse practitioner route before you do midwifery. That's just a step that I kind of took. And a lot of women's health nurse practitioners are kind of dual certified. So that's really cool. However, a midwife on their own is just as wonderful. So the definition of a midwife, well, the meaning of a midwife is with woman, right? So what that means, the biggest difference between midwifery and maybe your OBGYN, education-wise, it is basically their background. So midwife's background is in nursing, and your OBGYN's background is all in medicine. So that's kind of the biggest difference as far as like education goes. One is nursing, one is medicine. There are several different kinds of midwives. So I am a CNM, so I'm a certified nurse midwife. That is the one that is more readily known and more accepted in all 50 states. However, there are CPMs, so certified professional midwives, and there are CMs, which are certified midwives. So they just have different education than we do. Sometimes different things that they are and are not allowed to do. However, they're still in our family. So when you're talking about doulas are not actually like certified midwives. They're kind of birth helpers. They're there to kind of help you through the process, and they're a great kind of complementary. They're a great complement to midwives because they kind of believe in the same things. So the biggest thing I would say, you can get one stretch or the other with midwives. So originally it started out that, midwives, they always delivered at home. They delivered in birthing centers, and it was all holistic. It was all herbs. It was all, things like that. And now that science has kind of progressed and things are moving forward, midwives are now working in large hospitals. They're running labor and delivery units. And the biggest thing, people like to say, how do you differentiate kind of from midwives to an OBGYN? OBGYNs are still so like they're our asset, right? They're who we need. However, it has come to kind of science, and it's come to light that we have midwives to handle these regular, normal, everyday pregnancies and these deliveries, these natural deliveries. And we want to keep the OBGYNs for those more high-risk deliveries or people with comorbidities like diabetes, people who need C-sections, things like that. So when you're getting into these bigger hospitals, the midwives are doing all of what you call the normal labor and delivery work. And the physicians or the OBGYNs are saved for the more high-risk patients, or if the midwife runs into a complication that he or she maybe wasn't ready for in the past. So let me just touch a minute on home delivery. So not all midwives do home deliveries. Several midwives only work in the hospital. I am one of those. And the reason for that is because in my area, I don't really have any OBGYNs who are on board with that. it is coming to light and things are progressively changing, and things around midwives are rapidly getting better. But in bigger cities and bigger places, this is happening more and more and more. And there's a pretty rigorous screening process when you're talking about wanting to deliver at home. You have to be within a normal BMI. You usually, we don't want you to have any comorbidities. We don't want you to have a large baby. There's many things that go into it. But the reality is most pregnancies are what we call that normal pregnancy. So they can be more holistic. And labor and delivery it's a way of our life as a woman, right? So our bodies are programmed to do this. So that's probably the biggest difference between OBGYNs and midwives, is that midwives very much believe in just letting the body do its thing. Don't push, don't do induction, you don't need all these medicines, you don't do this, you don't do that. However, there's a time and place for that. And that's why OBGYNs are still so very, very important. In my practice, when we're talking about holistic, I usually use a lot of oils and herbs and, scents, and we do a lot of massage and we do a lot of dancing. I love to dance with my women. So we do lots of things like that to kind of, I deliver more babies in hands and knees position than probably anybody's ever seen. Because it's wonderful. It really is. So midwifery is just kind of about getting to know your body and learning the possibilities and learning different things about what our body is capable of doing. The woman's body is phenomenal, and you would be surprised how well your body can learn to cope through this. So, but I not for one second do I want to dog OBGYNs, because we still need them. But the reality is we need midwives too. And we need, there's lots of babies out there. And as time goes on and America's health is kind of deteriorating, we need those OBGYNs to control all the high risk and all these patients and all these C-sections. Midwifery patients have a lower C-section rate. And that is because, we're very patient. We like to wait for the body to do what it's supposed to do. And I won't get into a lot of statistics and things, but there are lots, baby outcomes, birth outcomes, lots of things that are very positive about a midwifery experience. And I think I had one question about what I thought about having a midwife and a doctor. I think that's excellent. I used to work in a practice with an OBGYN, and we were an excellent team. So I would a lot of times see them for their first visit, and they wanted to see me. They wanted me to deliver, but we made sure that he was in on a couple of appointments just to, I don't want to say double check me, but just to kind of put his input and make sure he knew what was going on. And it worked very, very well. So yeah, I think it's an excellent idea. A lot of practices, especially midwifery practices, a lot of them have a physician and then a midwife or nurse practitioner on staff. So you can actually see one or the other each time. I know a lot of practices, every other time you'll see the midwife, every other time you'll see the OBGYN, or like 2 and 1 or something like that. So that's definitely happening more and more. So yeah, I think that's a great thing. If you want to be with a midwife and a physician, I think that's great. If you're seeing a midwife who's like in a birthing center or some kind of clinic on her own, you can always see her and then maybe see a physician once every trimester if you want to, or really you don't have to at all, because the midwife will tell you if you are in that high risk category or not. Ultrasounds is another thing. As midwives, we don't do as many ultrasounds. However, if that's something you want, we cater to the patient. We do that. And usually we send you to a physician's office for something like that. So you would see the physician then. So definitely, I think it's a great thing. If you want to have a midwife and a physician, I think that's great. Definitely.
I wanted to say that I really love that you touched on the home birth question, because my mom actually had me in the hospital and then my sister at home, and she loved having my sister at home. So it was really neat that you touched on that. And I just also had a question. Do you think this is something that's becoming more common at midwives? And is this something that the office or hospital will bring up when you come to them and you're pregnant? Will they say, here are the different options? Or do you think you have to advocate for yourself if you want
You
to?
know, every hospital is different. You know, if you're from like a bigger city, they're very, like I said, a lot of midwives are, you know, you get admitted into the hospital and midwives are running the labor and delivery unit and you don't really have an option. Some places you may or may not even know that a midwife is an option for you. So usually you do need to kind of advocate for yourself and kind of ask, you know, see what's going on, see what your options are from the very beginning. So years ago, midwives were very, very, very common. And then as medicine kind of progressed, then medicine and science kind of progressed, you know, physicians kind of took the lead a little bit, and now midwives are kind of coming back up a little bit. So it's still a little low, but we're definitely making a comeback. So that's really, really cool. You know, there's all these shows about, you know, midwifery. Midwifery started in England, and you know, it was brought over here, and then started um yeah, started in Kentucky. So it's just really cool, and it's really fascinating how midwifery has kind of evolved. It's a really neat, I could talk for hours on the history of midwifery, but it's really neat how it's kind of evolved, and we've kind of became, you know, a lot of people call midwives some midwives medical midwives, right? So these midwives that are practicing, they still have all this holistic and all this for women and all this stuff, but because of science, they're practicing in the office and in the hospital. And so they have this different have all the medicine and science behind them if they need it, or they're using a combination of the two. And speaking for myself, I would say that I'm kind of that way. I use a little bit of both. And that may be just because of the environment that I work in the town that I'm from. If I worked in a different place where midwifery was a little bit more accepted, I would probably do a lot more, you know, home birth and clinic and that kind of thing. But again, it's all about where you're from and who's available in your area. But I do know they are out there. You just kind of have to look for them.
Okay, that's good to know. So this could be something that's part of your preconception plan, right? Is looking at the options are and where you're going, and again, making sure you advocate for yourself.
Absolutely. And you know, midwives are very um you know, they have a responsibility as well to you as the patient and also to your baby. So they're going to tell you, you know, you need to see a physician. I'm not comfortable with you or whatever. And the other thing that is really cool about midwives is we're actually licensed to care for the newborn up to 30 days of age. So if you have a normal natural birth and delivery, your midwife can take care of you and your baby. So that's really, really cool. You know, that's something that OBGYNs can't offer. You have the baby and you pass on to the pediatrician, but we're actually able to take care of mom and baby for 30 days. So that's also really cool.
That's awesome. And we did get a few live questions. Let's see. Someone asked, how much do midwives cost?
How much do they cost? So most insurance carriers do cover midwifery care. Anybody that I've ever taken care of, especially if your midwife works in the hospital, they're going to take insurance just like any other provider. And most midwives who deliver at home or have birth centers, they do as well. It's not. It's very common practice for midwives to accept insurance. Absolutely.
Okay, and then we had a question, what if I am considering using a midwife that is also a doula? How does that work and what are the benefits or cons?
I think that that's amazing. I mean, obviously, I think that midwives are a huge asset to you and your baby both, and I think that they're going to give you the best advice and lead you in the right direction. If this person was a doula, probably before they became a midwife, that is just an added bonus for you. That means they have lots of experience. They're going to show you things that have worked for them in the past. I think that's a great asset for you to have. Absolutely.
Okay. Then someone said, love the answer about seeing the midwife and OBGYN. Thank you. Let's see.
And that's the cool thing with midwifery is that, not every pregnancy is the same and not everybody has the same views. So you can kind of make it your own option, right? If you're seeing a midwife and an OBGYN in the same practice, it's still going to be billed through insurance as one pregnancy, and you can see whichever provider you want on whichever appointments you want. So that is one thing that I try to make sure that I tell my, friends, family, patients that this is your pregnancy. So you find the provider and go to the place where you feel most comfortable and you feel like you're going to get people to advocate for you and your baby. Absolutely.
That's good to know. That's awesome. What is your favorite part about being a midwife?
Oh boy. That's hard because I love it all. My favorite thing, probably, man, that's hard. Probably the look on the mom's face when you pull the baby out. That's probably my favorite part.
Aww.
Yeah, it's a very, very special thing to, people always ask me, what made you want to go into like gynecology and obstetrics, right? Because there's only a few large moments in people's lives, right? So one is marriage usually, and one is birth. And if you can be part of that moment for somebody, that is the coolest thing. And I guarantee you that all midwives feel that way. That's why we do what we do. And that's why we're so patient. And that's why we like to advocate and like to help our patients. And a lot of midwives have their own personal experiences. Like for me, I struggled with infertility. It took me 2.5 years and a cycle of IVF to get my twins. And they were in the NICU for 3.5 months. So I had a lot of midwives in and out helping take care of my babies. And they were the most near and dear to my heart, I felt like. So that's kind of where my thought process began. I always loved, the first time I was ever in a delivery as a nurse, I cried. So I knew right then, I was like, okay, this is gonna take me somewhere, right? But midwifery is awesome. I mean, it really is awesome. And I work in the hospital and do deliveries, and then I also work in the office where I see I see OB patients, but I also do like annuals and just basic things like that. And then I also work in surgery. So as a midwife and nurse practitioner, my realm of what I do is really huge. So I'm a first assist on C-sections, so that's really cool too. So like, if I have a patient who ends up needing a C-section, I'm still able to be in that section with the OBGYN. So again, it's just, there's so many options, and I just really urge you all to explore like your providers in your area and see who's available, because you would be very, very surprised.
Do you have any final thoughts that you want people to take away from this?
I guess I don't think so. I guess the only thing would be like, from my experience, there are some physicians or providers who frown on midwifery care. And that's just because they usually aren't enlightened to what we actually do or are capable of doing, or our education, I guess, and I have 10 years of education. I mean, I certainly am qualified to do my job. So it's just, you just have to remember that there is a certain group of people who may not think that we can do what we do, or don't know what we do. But we definitely are a huge asset to medicine as a whole and to the woman. So if you're interested at all, just make an appointment and go talk to a midwife. Go talk to a few and see which one you like the best. I mean, I think that that's really important to weigh your options, and certainly don't listen to anybody sway you in one direction or the other. I always tell people, go with your gut. 98% of the time, it's telling you the right thing. So I definitely think midwifery care and doula care is a good place to explore. Absolutely.
Wonderful. And we do have one more live question.
Okay.
Can a midwife order any blood work or other tests for women trying to conceive?
Absolutely. So I do all of that. I do, infertility. So I basically do everything the physician in my office does, but I don't do surgery. So if that answers the question, we can order lab work, we can order tests, we can read lab work, we order medication, we can take care of your baby, we read ultrasounds, we do ultrasounds. I mean, the list goes on. There's really, I do PAPs, I do colposcopies, I do, regular exams and checkups, and there's really not a lot that I don't do. So, yeah, absolutely. We can order all the tests you need, and all of those things.
So I just want to tie everything in together again there, that yes, you can find Tina right in your app, again, under more and schedule a consultation. So if you'd like to learn more about, I'm not going to say this right, midwifery?
Midwifery. Yeah.
Midwifery, it's short I. Or if you just wanted some general TTC help, she's right there for you. So be sure to take a look at her profile, contact her through the app, and we're excited to have you on again soon.
Yeah, absolutely. We'll be scheduling that next one, everybody.
All right. Thank you, Tina, and thank you, everybody, for being on with us today.